muscles. So you'll be joining us today. It is our big cat spay marathon. We have 4 big cats that are going to be spayed. The first is Tigress Polina. So they're going to be coming in to the hospital. And spaying a big cat is similar to your domestic cat on a larger scale, but the biggest concern is self-mutilation during recovery because of the itchy stitches. As you guys know, we cannot put a cone on the big cat's head, but also at the 7 to 10 day mark, we can sometimes have dehiscence in a big animal like a dog, a horse, or a tiger. And so we prepare not only up for the day of the spay for the surgery, but also the recovery for 7 to 10 days is just as extremely important as every component. So they're intubating her right now. And as you know, Paulina had an elongated soft palate. And so she was going to be spayed last year, but due to that elongated soft palate, we addressed some of the issues that were part of the cause too, which was severe acid reflux, and we've taken care of that. And so now it's time for this girl to be spayed. And spaying is very healthy for not only preventing cancer, but preventing pyometras. And sometimes getting that intubation tube in can be an art, not just a science. So we'll keep you live a few times today. We're not going to be live during the surgery because we want to be outside of the surgery room for sanitation. But Paulina has had an implant in, which means she wasn't going into estrus, so we didn't have to worry about her having any offspring with Tarek, who was neutered last year. But this is more for her health. So the next patient on the docket will be Alyssa, the Liliger, and then tomorrow will be lions, Alana, and Aurora. So they're trying to get her more situated.
Is that good? Does that help?
There. And because of her elongated soft palate, intubation has sometimes been a little more difficult than another cat. So we take our time to make sure everything's done correctly. So we have an extended team here today because there's our big procedures and we want to have vet teams there during induction and mobilization, as well as the surgeons, as well as through recovery down in their rooms. So we've kind of have 2 teams going today to make sure that each resident that's being cared for has a team with them at all time. Trying to get so with the new hospital, we're just getting the intubation tube in and tied. We've been able to bring them up in their crate, bring them right into rescue bay, get the weight like we wanted. They're moving the table down. We have a hydraulic table today. I can shut the door. So I'm trying not to talk too much today while they're working and getting her prepped. But you guys know how expensive, she's heavier than they thought. You guys know how expensive vet procedures are. Spays can be about $3,000 to $4,000 for a big cat, but with adding the extended vet team, it's about $5,000 per cat. So any donations are so appreciated. And a lot of that's the medication that's needed for surgery, for pre-anesthetic, for post-op. That can add up, especially the Convenia that we use. So we're gonna have to shave the tiger fur. Elise, will you get baggies for the tiger fur they shave, please? If there's time, we'll do paw prints, but that's only if there's time and if it's safe for the patient. You can see her big tail. And so if we can get any donations towards her spay surgery, that would be so wonderful. I want to do a shout out for LNC, who has donated already to cover 2 of our spay surgeries this week. So with your support, any donation would just help us cover the final 2 spays. So you guys have already done so much, but these are big days. A lot of preparation goes into this. A lot of coordination with the team so everybody knows their role. And it's very stressful because anytime you do a surgery on a big cat, you really worry that they're going to mess with the incision, and we don't want them to do that. So the procedure is one part, but that recovery is really the biggest stressor. So Teresa and her team make sure that they have 2 rooms in a building, that there's plenty of enrichment to keep them busy and trying to keep them off their suture or their incision. And we also give them pain medication, but other meds that would help make it less itchy and less wanting to mess with it. And that's kind of the cost that all adds up, and especially just the sheer volume that's needed of medication. So they're doing site prep right now.
The Ziploc right there for it.
There's they're just fixing the table right now. It's not locking up and down, so they're gonna do the lock. Sorry, I'm working around everybody, which is fine. We want them doing their jobs. Our job is just secondary to the work the team's doing today. So they're getting all the monitoring equipment hooked up. In addition to the monitoring equipment, we still do manually monitoring just to be safe. We have anesthesiologist techs here, as well as surgical techs. We're placing a catheter right now as well, and simultaneously prepping the surgery site. So if you just joined us, we are doing a spay surgery on Tiger Polina. This is a surgery that is an elective surgery, but for us it's extremely important because cats that aren't spayed, especially that come from breeding compounds or the rescues we do or roadside zoos that we're breeding a lot, we have a high chance of pyometra cancer or mammary cancer if we don't spay. So we do try and spay when we can, especially even in the big cats. All medium cats like leopards and cougars are always, and smaller are always spayed. It depends upon the age, the health, the demeanor and behavior that we know would take place during recovery of the cats when we make the decisions if we're going to spay or not. So I'm going to probably step out in a little bit, but we'll come live to you with each patient before the surgery takes place. You can see our little girl there has a tooth that is chipped, but it has not caused her any issues at all. And you guys might remember a live post back in the day where we were doing ultrasounds, scope and a CT on a witness protection tiger that you got to watch from the University of Minnesota, but didn't know who it was. Well, that was our girl Paulina here, and that was due to her elongated soft palate and severe acid reflux. So she's been on treatment for that acid reflux, hasn't had any breathing issues, been doing great. Another interesting fact that most of you guys do know, so you've been following us, is stripes are actually on their skin. So once we shave them, her stripe pattern is still on her belly. You can see that. So let's see if I can get close so you can see that. So the stripes go all the way to the skin. We're still working on a catheter. The drugs we use can sometimes lower blood pressure, which makes placing a catheter a little more work. But we'll make sure that Judson and everybody give you updates after the fact of how she's doing, how she does, and then of course you won't see a few of these cats on live posts for the next 10 days because they'll be inside their indoor rooms so we can keep their incision clean and dry. Well, we're going to step out since there's a lot of people in here, but today you'll also see in our viewing room that right now we have one intern and Kelly, but during next we have all the staff rotating in to actually get to watch a procedure and learn. So today they're doing rounds and food prep and meds, but during the day we'll see people come and go and being able to get to see. Also, we have a TV in here so that they can see what's going on above, because when you have this many people working on a cat from the viewing room, it can be hard sometimes to see what's going on. And we never want to interfere with what the vet team's doing. So this allows us another good view of what's going on. So your donations to the Animal Care Center helped us put all this education equipment into this building. And well, stay tuned, Paulina. It'll be a couple hour surgery and recovery, so we'll keep you posted. Judson is actually in there documenting today, and Timber's handling comments and things like that, so we might not be as readily available today. You won't be getting a regular sanctuary stroll, but instead we'll be posting live this afternoon again when Alyssa the Liliger is the next patient, and if appropriate, we might go live during recovery, but it really depends upon the day and making sure that we use the best time possible for the vets that we have on site, because their time's valuable, you know, and we just really want to get as many patients treated today with their procedures as possible. And tomorrow's a big day. Our staff was here about 6:30, starting prep just this morning, and it was gonna be a late night for everybody. We're also doing checks through the night for the next 10 days. So our staff on site will be not sleeping like they usually do on their overnight shift. They're gonna be checking in on all the patients several times overnight for 10 days. And we also have nanny cams on all of them, so we can look to make sure they're not messing with their incisions. And of course, our vet team's on site, and our vet team is going to be checking their incisions and how they're doing daily as well. So thanks for all the thoughts. Any donations towards the SPAY are really important and helpful. They're expensive surgeries, but so worthwhile to keep our residents happy and healthy throughout their life.